Welcome to Black Dog Hydrotherapy Centre. Hydrotherapy is using the natural properties of water, which are buoyancy, hydrostatic pressure, resistance and viscosity. The water in the pool and underwater treadmill is heated to encourage muscle relaxation and allowing us to encourage limb extension and build muscle more productively. The benefits of hydrotherapy are relief pain, swelling and stiffness of joints, improve muscle strength and maintenance, improve blood circulation and the lymphatic system, improve or maintain cardiovascular fitness, improve sensory awareness, improve mental well-being. And the conditions we treat are arthritis, hip, stroke, elbow dysplasia, stifle conditions after surgery or for conservative management, fractures, neurological conditions, tendons and muscle strains. Who is it who is suitable for hydrotherapy? Only dogs that vets feel would benefit from hydrotherapy, which is almost any dog. All dogs that come for hydrotherapy for whichever reason must have a vet consent form. We devise a treatment plan to meet specific needs of the individual dog. The patient will have their own file to record each session and monitor progress. We also work closely with vets and physiotherapists. Some dogs and cats are water-phobic, so we need to consider how we are going to introduce the animal to the water. Patients are assessed pre and post hydrotherapy. Health checks and gait analysis are included. Many of our patients, when they come to us, may have pain, stress and reduced confidence due to their condition. We use therapeutic touch, handling and patience to create a bond with the dog. Knowledge in animal behaviour is also essential in hydrotherapy, as well as anatomical knowledge. This dog in the underwater treadmill is Penny. She is a Labrador and she is aged 13.5 years old. Her medical condition is general arthritis in the left forelimb and the left hind and spine, more affected, and she had past arthroscopy on her left forelimb. Her medication is Librela. Penny started hydrotherapy in the pool, which provided a non-weight bearing exercise to help support her limbs and build her body mass and increase her cardiovascular level. Penny has now been transferred into the treadmill so we can continue to support and correct her weaker limbs. Penny enjoys her treadmill sessions and especially the Primula cheese treat. Visual observation of Penny's active range of movement in the treadmill is less extension on the right fore, internal induction at the left hind hock. Penny's treadmill speed will be slowly increased as her strength improves. It is more demanding for the patient working in water than walking on land due to the resistance of water. Poor placement to support and guide the limb in a more anatomical corrected range of movement. These corrections need to be slowly and gently applied so there is no force on the joint. Gentle passive stretches of the limbs once the muscles have been warmed up to encourage good extension and flexion. Owner feedback is important for a hydrotherapist, and videos of Penny on her walks help us analyse her quality of gait. We ask clients only to give their dogs short and frequent exercise pre and post hydrotherapy, as hydrotherapy can be a demanding exercise of a dog's body. The dog in the pool, Maya, she's a Rottweiler cross and she's 9.5 years old. Her medical condition referred for was right-sided paresis muscle weakness and reluctance to place weight on the right forelimb and the right hind limb. This resulted in an irregular gait pattern and muscle wastage. Maya was on non-steroidal anti-inflammatory drugs when her injury first began, but now Maya does not need any medication at present. Maya started her hydrotherapy in the treadmill to re-educate her gait and to encourage weight bearing on the right forelimb and right hind limb. Maya improved after treadmill rehabilitation and has now been transferred into the pool. This decision was made to enable Maya to still enjoy playing with a ball in the water with no impact and no strain on her joints. Today we are demonstrating the effect of swimming with a flotation jacket, which gives the dog more buoyancy and is used when a patient first starts hydrotherapy in the pool. Therapists also use hands-on support to help limbs that are weaker. Because Maya is weaker on her right side, we introduce gradual clockwise swims to engage and strengthen the body on the right side. We perform straight swims and directional changes to strengthen all the muscle groups of the body. Maya has now transferred into a harness which gives no extra buoyancy support. This is more demanding of the dog's muscle group and cardiovascular system. Working in the water shows weakness of the body easier than seen on land. We are also demonstrating that some clients may need 2 hydrotherapists in the water, one to guide and support and the other to gently use hands-on support and guidance of limbs. Pool and treadmill hydrotherapy consists of rest periods to assess vital signs of the dog. Maya demonstrates tight shoulder, neck and back muscle groups on bilateral planes of the body, but often greater on the left side due to overcompensation for her weaker right side. If the hydrotherapist has concerns regarding the dog's health or changes in their gait, we ask clients to take their dogs to the vet for assessment. Maya has never swum before she came to us. Gradually, she has become more confident in the water and can have a more active, happy life with her family due to hydrotherapy.